This is an Eastern Pennsylvania Continuum of Care coordinated entry training. The focus of this training is editing an existing core entry enrollment in PAHMIS client track. The enrollment sometimes changes when a core entry participant contacts core entry again. It may be calling 211 again. It may be entering one of our regional access sites and sharing some updated information about their living situation, their household composition, or other changes that could impact their housing assessment tool score, which could change their prioritization status. So, really, this is about editing a Category 1 or Category 4 enrollment. And the way to do that is to first go to the client's dashboard. This is a visual of our training environment, so it looks slightly different than in production, but essentially it is the same design and layout and features. So scrolling down to the active enrollment, the way to edit an active enrollment is always, always, always to edit the entire enrollment workflow, never to use other aspects of the client menu to go directly to a living situation or other parts, but because that will not incorporate those changes into the housing assessment tool score. You must make all changes to an active enrollment by editing an existing workflow. So, clicking on the three dot ellipsis menu and going to Edit CE Client Intake Workflow is the right way to edit an existing core entry enrollment. You will then go screen by screen. If it is a DV anonymous enrollment, you select yes because you'll be editing a DV anonymous workflow. If it is a standard enrollment, you would select no because you'll be editing a standard workflow. You can confirm some things here. It's good to confirm that this information is accurate if you have the time to do that. It's also good to make sure that the optional but very valuable contact information is still accurate. It's possible the head of household has a new phone number or email address, so we want to make sure we capture that. If you make changes to the screen, for example, adding a work phone number that is safe to contact, you would press finish. If there are no changes, you would just press no changes, but I made a change, so that'll be saved by pressing finish. You may also at this point add additional family members or make a change to an existing family member because the other family members besides that have household would only be available on these lines. And our other trainings go through the process of adding a family member. There are PAHMIS core trainings on removing household members. And if you're not sure how to do that, you would submit a help ticket using the help question mark icon in the lower left portion of your screen, or informing your supervisor that you need to remove a household member. But adding a household member works the way it does for any assessment or modifying a piece of a family member. For example, if there is a family member in the household that is now pregnant, you would tab over to that section of the family member screen, for example, and you would be able to change the pregnancy status. In this case, we are not adding a new member, and so we would just, it looks like the system thinks we started to, so I do need to scroll back, uncheck that, and then I can save and close moving forward without any changes. The enrollment hasn't changed, but if you were adding a family member to the household and they want to be part of this enrollment, you'd also have to check them here to add them. In this case, there are no changes. Universal data assessment. If the prior living situation, which is really the same as the current living situation where they stayed last night, has changed, you could modify that here. Ignore health insurance. We never collect that information. In this case, I'll say there are no changes to that. It's possible translation assistance is now needed when it wasn't before. You could modify that, but I have no changes here. Triage assessment is where there may be some additional changes. For example, if now no one in the household is employed, this is a single person household and they've lost their employment, you would change that to no. for example. And again, if their current living situation has changed, perhaps now they're staying in emergency shelter, you would modify that here. And if they are now interested in living in additional counties, we'll just say Bradford, you could add that as well. Because there are changes to the triage, we would select Save, and that will lead us to the housing assessment tool. If you're editing the workflow, you will always say yes to complete or update housing assessment tool, even if you don't anticipate changes to section 2. Section 1 is auto-populated by the responses to the other questions. So for example, if this head of household were now pregnant and we had changed their basic client information to pregnancy status yes, there would now automatically be one additional point in section 1. You as a CE specialist cannot edit section 1, but you can edit section 2. So if they contact us again and say, for example, as I've shown here already, there was a change last time the person contacted core entry after enrollment because they had forgotten that they were evicted 6 years ago. So an update was already made to their HAT score. Client remembers eviction from 6 years ago. But let's say they are willing or want to disclose now that since they last spoke with core entry, they have engaged in dangerous or illegal activities, then one could change no to yes. That will increase their score, but you would add an additional comment. Third, contact with head of household, disclosure of being engaged in dangerous activities. Again, we're not asking them to disclose the specifics of what those are. We are simply acknowledging that that is what they are self-reporting to us. We're adding a note which helps our CE regional managers. And because we've made a change to the HAT score, we're selecting save instead of no changes, and we're finished. So make sure you click finish, close the workflow. At this point, you could make additional referrals if new referrals are needed to emergency shelter, for example. But otherwise, that is how you edit an existing CE enrollment by editing the entire CE intake workflow and saving along the way, even screens where you're not making any changes.